Hey, my name is Matt Blois, and you're listening to Medically Necessary, a podcast about the healthcare supply chain. On the show, I talk with experts, business leaders, and researchers about how they get drugs, devices, and medical supplies to healthcare providers and patients. This podcast is brought to you by Ryder, the only fully integrated logistics and transportation provider in the industry. Ryder's solutions cover the entire supply chain, including warehousing, transportation logistics, e-commerce fulfillment, and last mile. Discover how Ryder can make you ever better at ryder.com. So over the last few months, I've been talking to researchers and business leaders who say the pandemic has changed the strategic importance of the supply chain. It used to be that healthcare supply chain was all about reducing costs, but after the pandemic, that focus has really shifted a lot more towards resiliency. So today I'm talking to Rudy Silva about how the pandemic has changed the strategic importance of the supply chain in healthcare. Rudy is the group director for customer logistics for our sponsor, Ryder, and has more than 25 years of experience in operations and logistics management. At Ryder, he leads operations in the retail, tech, and healthcare markets. So Rudy, thanks for joining me on the show today. So I just want to start with something pretty basic. How do you think the pandemic has changed the way healthcare providers in general think about the supply chain?
Sure, Matt. Thank you. Thank you for having me on. The COVID-19 pandemic has stressed many healthcare supply chains to the breaking point. The pandemic highlighted their strengths and weaknesses more than ever before. The extreme demand swings and inventory shortages really exposed them. Healthcare providers now realize the importance of speed, agility, redundancy, and real time information can prove to be invaluable in a time of crisis. To accomplish this, healthcare companies need to have contingency plans in place that can be executed during any time of disruption, whether it's inventory shortages, transportation capacity, or pandemics.
Yeah, I think it makes a lot of sense. It's just like you said, it's the pandemic just really put a lot of stress on things, and I think it really became obvious why all of those tools would be super useful. So I know Ryder does a lot of work with medical suppliers and device manufacturers. So I'd be interested to know, in that portion of the healthcare specifically, in device manufacturers or suppliers, how has the pandemic changed the way that they're thinking about the supply chain, specifically that section?
Sure. Well, the pandemic forced healthcare supply chains to make significant changes to the way they work, both tactically and strategically. I mean, just look at the impact of social distancing had on how we do things now. Agility is being pursued as supply chains look to diversify suppliers of raw materials, giving them additional flexibility during disruptive events. Medical suppliers and device manufacturers are carefully increasing stock of specific SKUs and leveraging analytics and real time visibility tools. They are rethinking inventory levels and the need for nearshoring, even if it impacts cost. I mean, prior to this, it was really about lowering the cost of goods sold and offshoring and getting it as cheap as possible. And now they're realizing, well, they need more inventory and they need it close by and to be able to have that thing readily available.
Yeah, that totally makes sense. So can I go back and get a couple of definitions quickly, just for listeners who may not understand all the terms, and for me who may not understand all the terms? I think you said one would be interested in. You said SKUs there. I think they were stocking up on certain SKUs,
Oh
and
yeah,
then the other one, and
yeah,
then the other two that I think would be good to define is nearshoring and onshoring. So I
sure.
mean, what did you mean by stocking up on specific SKUs?
Well, a SKU is a stock keeping unit, an item, right? An item that they have on stock. So, they're holding more critical items on hand, especially for device manufacturers, those raw material components, keeping them closer uh, than what they had to previously. And as far as nearshoring or onshoring, again, in traditional manufacturing, you're trying to get the lowest cost of goods sold, and that meant, at times manufacturing things further away, India or Asia. But with that came lead times. And now nearshoring is moving things closer to either Mexico or, producing things domestically here in the United States, even if it drives the cost up.
Yeah, I think that makes a lot of sense, and thank you for giving those definitions. I think that there's just helpful context. Um, so I wanted to ask you also about when I've talked to other business leaders about what's been happening during the pandemic, I keep hearing over and over again that in a lot of cases these are really any some of the changes we're seeing are really continuations of trends that were already in place before we even heard of the coronavirus. But I'm wondering if that's true. I wonder if that's the case for this sort of increasing importance of the strategic or the increasing importance of the supply chain and sort of the shift towards resiliency. I mean, do you see that as something that was a trend that was already happening before the pandemic started, or is it something that is really the pandemic totally shifted the way we think about it?
Uh, I'd say they're brand new. I mean, the status quo that had evolved in many healthcare supply chains really caught everyone flat-footed. They're realizing that supply chains cannot be as rigid as they had been for decades. They need to be nimble and have tools and information readily available to make decisions quickly. The coronavirus pandemic has proven it's difficult to predict what the next challenge will be. Something familiar like an inventory shortage or complex like another pandemic.
Yeah. I sure hope not, but I guess you got to be prepared for that. And I mean, this is not the first disease outbreak we've had recently. I mean, there's been a number of them. This just is the one that has gone global. Um, so I'm also wondering, I like to think about the future and kind of what we've had all of these changes. How how long do you think this shift towards more emphasis on resiliency over absolute all about being all about lowering costs? How long do you think that shift towards resiliency is going to last? Is this something that's going to stick around for a very long time, or is this something that as more people get vaccinated, as cases go down, that is going to shift back towards the way it was? What do you think about that?
I don't think so. I think that I believe healthcare supply chain leaders are embracing this disruption as an opportunity to drive their supply chains further. They're adding new capabilities, looking for a partner that provides end to end solutions that will not only benefit their response to a pandemic, but will also make their supply chains better once the world transitions to back to normal, back to the new normal. What happens today may not be the case tomorrow. And to keep the supply chain running, you need to be in a position to quickly pivot depending on the situation. If you can't, it will affect patient care and your bottom line. Healthcare supply chains need to put some thought behind strategies and contingencies to have the flexibility to support change. And that's where a partner like Ryder can come in. They can create a playbook that will allow a healthcare company to face any disruption and smoothly shift strategies to keep the supply chain running.
Yeah, yeah, I think that makes a lot of sense, and I like what you said too about the linking the how good your supply chain is to patient care because there's an effect there, and I think that's something that's always really important to keep in mind. Um, so I like you're saying, Ryder has the ability to sort of create a playbook and help healthcare companies that are doing this sort of thing. So what is it that you think makes Ryder different? What do you guys do really well?
Yeah, as an integrated solutions provider, Ryder is uniquely qualified to support healthcare supply chains by leveraging our nearly 90 years of industry experience in logistics and our tech forward approach to provide innovative customized solutions in this ever changing landscape. Ryder engineers solutions around a company's operation instead of making an operation fit into a common solution. We optimize logistics networks by providing end to end solutions that service the customers. We optimize logistics networks and that include warehouse and distribution management, design, engineering, planning, and transportation services. Through our focus on continuous improvement, as well as our proprietary innovative technology, we drive optimization by eliminating waste and turning data into actionable business intelligence and providing real time visibility. And that real-time visibility and transparency is critical, especially like in 2020, where decisions need to be made quickly.
Yeah. Well, I like what you said there. I'm forgetting exactly the words you used, how you put this, but the idea of designing a solution to fit a problem rather than finding a solution that you really love or finding technology that you really love and trying to fit that into your company because it feels like something that you should be doing or without having a specific problem to address. So I like that idea of um, being specific about what the solution is going to do.
Our solutions are customized to solve that customer's problems instead of putting up facilities or putting up warehouses in target areas and build it and they will come, or build it and try to fill it. Now, our solutions, we place facilities in cities that best suit the
Yeah.
customer.
So yeah, so we've been talking a little bit about how the pandemic has affected the healthcare supply chain in general over the last year. It's certainly been a tumultuous year. I'm wondering how this has all been for Ryder. How have you guys adapted to all the different changes that have been going on over the last 12 to 13 months?
Absolutely. Well, having the ability to make real-time informed decisions is critical. And the supply chain environment is changing rapidly. With constant change and industry disruption, having a responsive and resilient supply chain can lower the cost to serve and provide better patient care. And through our innovative, ultimate digital platform, RiderShare, created this past year, and other innovative technologies, we use descriptive and diagnostic analytics to drive improvement and provide business intelligence and deliver transparency. Uh, those changes will allow healthcare supply chains to overcome complexities and meet KPIs and ultimately reduce overall cost to operate.
And yeah, I think that makes sense, and yeah, that totally makes sense. So what piece of advice would you give any of our listeners? I think a lot of our listeners are in the healthcare industry. They're looking to make a change or looking to work with a 3PL that specializes in healthcare. Do you have any advice that you'd give to those listeners?
Well, absolutely. I would say, start with the end in mind. By this I mean, how will this impact patient care? Because that's ultimately what's the most important, right? Is patient care. And by outsourcing with a proven end-to-end supply chain provider, a healthcare company can increase their quality of care or the quality of product by focusing on their core competencies and allowing proven subject matter experts in supply chain to focus on their core competencies. I would also suggest looking for a provider like Ryder that has lean continuous improvement at its core part of their DNA. That is backed with innovative technology solutions that can flex rapidly with change and meet the increasing demands.
Yeah. Well, thanks for that. So this is going to be the last question. This is I like to end the newsletter this way, and I've been ending the podcast this way too. Basically, in the newsletter, I call this section "Wishful Thinking." I just give sources or readers or other people associated with the newsletter. Say, okay, you've got one wish. You've got this magic wand to make any change you want to the healthcare supply chain to try and make it better. What's your one wish?
Well, this is an exciting time to be involved in the healthcare supply chain industry. Historically, uh, supply chains have been difficult to overcome change. And I think the pandemic, has real people have realized that they do need a change. And the pandemic impacts have forced supply chains to make adaptations, while it's also proven to be a catalyst for significant changes in the way we work. Um, Supply chain leaders are recognizing the need to bring in additional talent that has been exposed to best practices in other industries, things that have worked in other industries, not necessarily associated with healthcare, but recognize that those best practices are in fact transferable to healthcare. It's an exciting time.
Yeah, that's an interesting thought. Bringing in expertise from places outside of healthcare to try and make healthcare better. I think that's an interesting perspective for sure.
Absolutely.
Well, thank you so much. Those are the end of my questions. I'll just say, was there anything else that you wanted to talk about that we didn't get to, or just anything else that you wanted to say before we wrap things up?
No, I appreciate the invitation. Again, I think this is an exciting time to be in the healthcare supply chain. I think that the pandemic forced us to look at things differently now, and look forward to things to come.
Great. Well, thanks so much for joining me on the show, Rudy. I thought this was a great conversation.
Appreciate it, Matt. Thank you.
Thanks. Have a good day.